Hello friends, welcome back to Complete Medical Coding, a complete CPC learning channel. Today let's learn the remaining portions from ICD, that is chapters 19 to 21. These chapters includes codes from S to Z, S to Z codes, chapters from 19 to 21. Okay, so friends, if you are new to the channel, please support me by subscribing to the channel and please press the bell icon so that you will not miss any videos. So let's move to the chapters one by one. Let's move to the first chapter, like chapter 19, S and T codes. Chapter 19 consists of S codes and T codes. This is a very important chapter. You will get so many mixed type of questions from this chapter. Okay, mixed type of diagnosis, like S codes mixed with some other codes, T codes along with some other codes. So this is very important chapter. Okay, so S and T codes. This chapter mainly consists of injury and poisoning. Injury and poisoning chapter. And there are mainly three factors that you have to consider while coding S and T codes. Type of injury, site of injury, and the laterality. Type of injury represents there are three types of injuries: burn, poisoning, and fracture. Each one is important. How to code each one? Burn, poisoning, and fracture. Then comes the site of injury, where it has occurred. Then comes the laterality, means side, whether it is bilateral or unilateral or which side it is. Okay. So these three you have to always check while coding for the injury. Now, superficial injuries such as abrasions and contusions are not coded when associated with major injury on the same site. If you are coding some major injury on the same site, then superficial injuries such as abrasions, small injuries, okay, abrasions and contusions, they cannot be coded. For example, if a patient is having fracture and abrasion on the leg, code only for fracture. The patient is having both fracture and abrasion on the leg, same site. Okay, leg is the same site, right? So we will code only fracture. We will not code the abrasion. But if the patient is having fracture on hand and abrasion on leg, so here the site is different, right? Fracture on hand and abrasion on leg. Then we will code for both fracture code and abrasion code we will use, because the site is different. But which is the major injury, that has to be coded first. Major injury, major comes coded first. Okay. Now let's look into all the three types of injuries one by one. First, let's look into the fracture. Fracture is divided into two sections: traumatic codes and pathological codes. In this chapter, we will learn traumatic codes. Traumatic codes means codes due to or injury due to fall, some fall or accident. That is the traumatic codes. These are S codes. S codes we are discussing in this chapter. So traumatic codes are important. The second one is pathological codes. Pathological codes we have already learned. Pathology means due to some condition or a disease. So pathological codes are M codes that we had already learned from chapter 13. Okay. So default will be traumatic codes. That is what we are currently learning. S codes. So always the default will be, if some injury, if some fracture, if in the question if it is mentioned about some fracture, default will be traumatic codes if nothing is mentioned. Okay. Now, what does code M80? What is the difference between code M80 and M81? M80 represents osteoporosis with pathological fracture. M81 represents osteoporosis without pathological fracture. Code M81 also if there is any history of fracture. If there is any history of fracture, we can code M81. that is osteoporosis without pathological fracture. Okay. If any osteoporosis patient met with a fall, then don't use S code. We will use only M code. Osteoporosis patient met with a fall. In that case, we will use only S codes. We will not use the M code. We will not use the S code. Instead, we will use only M code. We will use only the pathological code. Okay. Now, what are the different types of fracture? There are open and closed fracture, displaced and non-displaced fracture. If you consider open and closed fracture, we will use closed fracture as the default code if nothing is mentioned. If nothing is mentioned in the documentation, then we will use closed fracture as the default one. And from displaced and non-displaced, we will use only displaced fracture as the default one if nothing is mentioned. Just we can look into one example. Initial encounter for fracture right hip with dislocation. Initial encounter for fracture right hip with dislocation. Fracture of right hip with dislocation. In this case, we will code only fracture because site is the same. Fracture of right hip with dislocation. So, we will code only the fracture, and this is the code for fracture is 79.911A. This is just an example for your understanding. Okay. Now, let's move to burn. The next type of injury, which is burn. This is also important. Here we will look into three important points: the depth or degree, whether it is primary or secondary or tertiary. The depth of degree, extent, and agent. What is the depth? What do you mean by depth or degree? Means primary, the degree of the burn, primary, secondary, or tertiary. Primary means it will be a superficial. Only epidermis is affected, means outer skin layer is affected. Secondary means both epidermis and dermis is affected. Both the layers are affected. And tertiary means all three layers of the skin are affected. Epidermis, dermis and subcutaneous. All three layers of the skin are affected. Tertiary, which is the major burn. Okay. Now, extent. Extent means the percentage, how much percentage of the body is affected by burn. TBSA represents total body surface area. You will get burn in the questions regarding burns. You will get this short form TBSA, means total body surface area. T31 is a code that represents less than 10% of TBSA. If the burn is 10%, less than 10% of total body surface area, then we will use T31 code. For example, if percentage is given separately, calculate all percentage to get the TBSA. If percentage is given separately, it means separate percentage is given for different parts of burns. For example, 10% in hand, 10% in leg, 10% in face, something like that. The percentage is given separately, you have to calculate all the percentage to get the total percentage value to get the total body surface area. That's how you need to calculate the burn. Accordingly, you have to code it. Okay. So that is extent. The next one is agent. Agent we'll be discussing in chapter 20. What is agent? Okay. Now corrosions. Corrosions are burns due to chemicals. Corrosions are different types of burns. Burns due to chemicals are called as corrosions. Now moving on to poisoning. That is the next injury level. Injury. Type of injury. Poisoning. First code always will be the drug code. In poisoning, you have to always code first the drug code. Drug code you will get it from the index page, table of drugs and chemicals. In the initial index page, table of drugs and chemicals. From there you will get drug code. Choose from any of the first four columns. First four columns are mentioned, you have to choose from that. Otherwise, you will get it from the codes also. Okay, this is From the table also you will get it, and from the chapters also you will get it. Now, second code for manifestation. So first you have to always code for the drug code. Secondly, you have to always code for the manifestation. For example, unconscious, like that. Now, what is adverse effect? During adverse effect, in some documentation which is mentioned adverse effect, you have to first code for manifestation, then code for the drug code. Okay, the default poisoning will be, codes will be always code initially the drug code followed by the manifestation code. But if in question it is written adverse effect of the use of drugs or adverse effect, then you have to code first for the manifestation, then secondly code for the drug. Now, underdosing and overdosing. I think we have already learned about underdosing and overdosing when we learned E-codes, chapter from E-codes, right? So, underdosing means less use of medication. Code first for the condition, then code the drug code. If the question is related to underdosing, first code for the condition and then code for the drug code. For example, DM. Same we have learned in E-code chapter. For DM patient, underdosing of insulin, how you will code? First always code for the DM, then followed by code for insulin underdosing. Okay, this one I had detailed. I had mentioned it detailed in that chapter when we have learned the E-codes. You can just go through it. Now let's move to chapter 20, which is VWXY codes. Chapter 19 consists of S and T codes. Where is U? There is no U code in ICD. Okay. So in chapter 20, we will learn from V to Y, VWXY, 4 types, 4 codes. Chapter 20 and 21 is very easy. So this one, we will get it from the external causes of injuries. In index, external causes of injuries. That is the agent which was mentioned in chapter 19. External causes of injuries. These codes will never be the primary code. This will be the add-on code only. These codes will never be used as a primary code. Not add-on, secondary code. We will use it as a secondary code. Code always the condition first. And we should code how it happened. First code the condition, then we should code how it happened. Like for example, see, intent. Suicide, assault, intentional, unintentional, whatever it is, we have to select it. How it happened. Then place, where it happened. Then you have to check for the person status, whether the patient is or the incident happened is a military accident or the patient is a construction worker. Okay. So in this case, there is a sequencing priority. If the external causes is 2, code for the priority. If there are 2 external causes mentioned in the documentation, you have to code for the priority. For example, the detailed one, it will be coming in the next slide. See, code first for the child and adult abuse. If there is any child and adult abuse, you have to code priority as the child and adult abuse code. Abuse codes should be used as the primary. For example, T74 and T76, both are abuse codes. So primary is the abuse code. Second priority is for the terrorism. Okay. Third is for cataclysmic events, means disasters, natural disasters. And fourth priority is for transport accidents. So this is how the priority goes on. So this is the sequencing priority. If the external cause of injuries are two external cause of injuries are mentioned in the question, then you have to check which is the priority one. Code the priority first. And this is the order. First one is abuse codes. Child or adult. Abuse codes first. Second priority is terrorism. Third one is cataclysmic or natural disasters. And fourth one is the transport accidents. Okay. So that's it for chapter 20. In chapter 21, consists of Z codes. There is not much guidelines. These are codes that can be used as primary or secondary. Sometimes some Z codes can be used only as a primary code. Some Z codes can be used as both primary or secondary code, which depends on the condition. Okay, and this can be used as a history codes also. We are using Z codes usually for pregnancy along with pregnancy codes, right? O codes. So they are considered as history codes also. So you will get history codes. Then primary, this can be used as either primary or secondary codes. Okay, so that's all about chapter 21. So friends, these are few guidelines from chapters 19 to 21 from codes S till Z. So right now we have completed the ICD code book, the few guidelines from ICD code book. Now when you will go to when we will discuss more questions, more and more mock questions, we will be you will come to know more about the guidelines, how to code along with CPT, how to code along with HICPICS. I will be conducting another session for HICPICS separately. Okay. So anyway, we have completed the CPT and both CPT and ICD code book. If you have any queries, please mark it in the comments, and please support me by liking and sharing my video. If you are new to the channel, please subscribe to my channel and stay tuned for more and more mock questions will be coming up, and examination coding tricks, how to easily pass the examination, everything I will be discussing in the upcoming videos. So stay tuned, friends, and thank you so much for your support. Bye, take care, see you in the next episode.